I'm Dr. Sreekanta Swamy, Head of Neurology at Aster RV Hospital, JP Nagar, Bangalore. I'm here to give you some information regarding a disease called Parkinson disease. This is a disease where many people are not aware because name itself is difficult to remember for a common man. Parkinson disease is a disease categorized or grouped under a disease group called a movement disorder. In this disease, patient usually have this disease after the age of 60. If you take, it is almost like 1 in 100 people after 60 can develop this. And why this happens, there is a hormone called a dopamine inside the brain, which is required for us to control our movements in a required way. Or precisely we have to control our movement by this hormone. When there is a deficiency of production of this hormone by the cells, that is when we develop this disease. In this disease, it is a progressive disease. One should understand this is going to be with the patient once it starts and ends with the patient. And this is not going to be the same disease at one particular time. It is going to be increasing day by day. So it is called a neurodegenerative disease. And in this disease, the main symptoms are patient will become gradually slow. It is a slow process. And they will have shaking of the hands, either one side or both the side. Their movements and thought process, everything becomes slow over time. And there can be tendency to fall and lose balance. And later their voice becomes low volume, and sometimes they bend forward to catch up their gravity of center. And later course in the disease, they may have memory impairment. And most unfortunately, as of now, most of the routine investigation that we do are all going to be normal in this Parkinson disease. So it depends on what we see and examine and observe in the patient. There are a lot of treatments that are available. Of late, there are multiple drugs available. Most of the drugs are to control the symptoms, not to cure. There is no cure for the Parkinson disease, one should understand. And if judiciously used and carefully selected, this medicine can make the patient's life easy and comfortable. And this disease is a progressive disease. That means day by day, year by year, month by month, it becomes more and more. So as the number of years goes on, the effect of the medication also starts to come down and side effects becomes more. So it becomes a very tricky situation for a common general doctors to manage. So an expert is required to manage these patients. When the drugs are not effective or drugs are giving a lot of side effect, there is a surgery called a DBS surgery, deep brain stimulation surgery, which is available in most of the major hospitals in Bangalore city, including RV Aster Hospital. So we do have DBS surgery facilities. We do have facilities to look after these patients. The patients who are suffering from Parkinson disease are majorly looked after by a specialist called a movement disorder specialist. So you should avail these facilities because this disease may go unnoticed for 1 to 2 years in the beginning. So be aware of the symptoms, make use of the facilities and drugs that are available, know what are the recent advances in the treatment and what is the prognosis. So you don't have to suffer all through your life. With the medication and surgery, you can lead quite a good, comfortable life. That is my message to all of you.